What really happens during menopause? Have you ever stopped to ponder this question? Menopause, a term that's often thrown around, but seldom understood in its entirety. Today, we're going to delve into this fascinating biological process that marks a significant transition in a woman's life. Menopause, in its simplest definition, is a natural phase marking the cessation of menstrual cycles. It's not a disease or an ailment, but a normal part of aging. It usually occurs between the ages of 45 and 55, but can happen earlier or later. So what triggers menopause? The answer lies in our hormones. Our bodies are essentially hormone factories, producing different hormones to regulate various bodily functions. Two key hormones, estrogen and progesterone, control the menstrual cycle. As women age, the production of these hormones gradually decreases. When the ovaries stop producing enough of these hormones to stimulate monthly menstruation, that's when menopause begins. But menopause is not an overnight process. It's a gradual transition that unfolds over several years. This phase, known as perimenopause, can last for up to 10 years before the final menstrual period. During perimenopause, hormone production fluctuates, causing irregular periods and other symptoms such as hot flashes, night sweats, and mood changes. After a year of no menstrual periods, a woman officially reaches menopause. At this stage, the ovaries have stopped releasing eggs and producing most of their estrogen. Post-menopause, the symptoms of perimenopause can continue for some time, but they usually lessen in intensity. It's also important to note that menopause can impact sexual desire and comfort. The decline in estrogen can lead to changes in the vaginal tissue, making it less elastic and more dry, which can affect sexual comfort. However, with open communication and various treatment options, these issues can be effectively managed. So, to recap, menopause is the natural end of menstruation, triggered by a decrease in the production of the hormones estrogen and progesterone. It's a gradual process, starting with perimenopause and culminating in menopause after a year without periods. The hormonal changes during this transitional phase can cause various symptoms and can impact sexual desire and comfort. Understanding menopause and the changes it brings can help women navigate this phase with confidence and ease. It's a transition, not a setback, and with the right knowledge, it can be managed effectively. And remember, knowledge is power. To empower yourself with more enlightening content like this, make sure to subscribe to our channel. Your journey towards enlightenment is just a click away.